Hello, my name is Shelley Brown, and I'm a registered dental hygienist. I own a mobile dental hygiene program here in Utah, where I've had the privilege of working with older adults and individuals with disabilities in public health settings. In my work, I've seen firsthand the value of minimally invasive dentistry, also known as MID. So what even is this? Minimally invasive dentistry is an approach that focuses on prevention and healing of tooth decay without removing tooth structure. For older adults and medically complex patients, this philosophy is critical because it reduces stress, it increases comfort, and it helps maintain oral function and quality of life. These options respect the unique needs of older adults who often deal with dry mouth from medications, they're at higher risk for root caries, and they have sometimes a limited tolerance for invasive care. So instead of the old drill and fill model, MID emphasizes early detection, prevention, and conservative treatment. It's not just a set of techniques, it's really a patient-centered philosophy that makes high-quality care more accessible and less intimidating. Let me give you a quick example here. Many of us know patients who are anxious about the drill or even the shot. So with minimally invasive dentistry, instead of rushing into a long, painful appointment, maybe we are able to manage that early decay with silver diamine fluoride, a really powerful liquid that can arrest caries painlessly until a more invasive treatment is truly necessary. The benefits are huge for MID: less pain and anxiety for patients, lower costs compared to traditional dentistry, and greater access to care, especially in underserved or rural areas, and ultimately better long-term outcomes for patients. So some of the most powerful MID tools include early caries detection technologies. Our traditional methods often identify decay too late, when it already shows up as a white spot lesion, or demineralization on a radiograph. So our new paint-on technologies allow us to detect caries at the earliest stages, down to 20 micrometers of demineralization, so we can intervene and fortify these areas much sooner. Silver fluorides, which arrest caries and remineralize tooth structure and also prevent recurrent decay, can prevent new lesions at similar rates to sealants. We also have our P11 peptides, which help remineralize and strengthen enamel on white spot lesions, extending the lifespan of natural teeth. We also have our glass ionomer restorations, which release fluoride, and they're really forgiving in those challenging settings where moisture control is really difficult. We also have povidone iodine 10% application, which reduces cariogenic bacteria. This antimicrobial can be applied monthly for high-risk patients, every other month for moderate-risk patients, and is not needed for those who are at low risk. And of course, we also have our fluoride varnish, which should be applied more frequently for patients at high risk of caries. The foundation of MID is simple: detect earlier, treat conservatively, and preserve what is healthy. That means selective caries removal, conservative restorations, and a focus on prevention and regeneration rather than replacement. It also helps prevent patients from entering that amputate and restore cycle, where healthy tooth structure is lost unnecessarily and restorative needs spiral over time. The CareQuest non-invasive dentistry flowchart is an excellent resource for determining the best treatment options for active versus non-active lesions. As we've seen today, minimally invasive dentistry is not just a clinical technique, it's a philosophy of care. By detecting disease earlier and choosing strategies that preserve the tooth structure and support natural remineralization, we give our patients healthier, longer-lasting outcomes with less fear, cost, and discomfort. The future of dentistry lies in prioritizing prevention and regeneration. Each of us plays a vital role in shifting the standard of care towards early intervention, personalized therapies, and really access for all. By embracing these techniques, we can truly stop the restorative cycle before it begins. Together, we can help our patients keep their natural teeth strong, functional, and beautiful for a lifetime. Thank you for joining me today.